Hi, this is Mike Protack again on issues affecting the state of Delaware and our great country. We're going to talk about healthcare again today. It's a subject that's just not going to go away, and the more the President talks about it, the more Washington offers their solutions, the more important it is for us in Delaware to understand what the ramifications are of any proposals. And quite often it's easy to oppose something, but then most people say, okay, what are you for? What are you going to do about this? This is a real issue. What are your solutions? Well, let me phrase it first by saying this. Delawareans spend over $6 billion a year on health care. That's a lot of money, over $6 billion. So roughly each one of us is spending about $6,500 a year on health care. It's a lot of money. We can spend it a whole lot better. So how do we do this? What can we do? Some people say single payer, some say don't do anything. We've come up with a proposal that's I think quite unique. It blends, I think, the best of almost everything you can do. It still increases a patient's ability to decide what they want to do with their own money, but also covers everyone smartly. We call the program Delacare. And how's it work? It's really relatively easy, not complicated in any way, but it's a very simple approach to making sure everybody in Delaware has health care that makes sense. So what do we do? First thing we can do is Delaware is a rather small state, and this can be done nationwide, but let's talk about Delaware. That's the place we live, that's the place we care about the most. You could put Delaware in one single pool, one large pool, and institute a basic plan modeled very closely after Blue Cross Blue Shield's plan for the state of Delaware. A good quality plan that covers catastrophic expenses and gives you a pretty decent monthly premium. So that's the first point. Second is that basic plan will come from negotiations with labor leaders, business leaders, all the stakeholders in the state of Delaware will decide what this is. The folks that represent all the interests in Delaware across the spectrum will come up with what this basic plan is. So it won't be a one-size-fits-all, you get no selection. There will be lots of input to come up with a good, solid basic plan. That's important. Then what we can do is we have this basic plan. We can go to every insurance provider, every entity that's licensed in the state of Delaware and say, come up with a plan, your costs on how you can administrate this basic plan for all 850,000 or so Delawareans. That's where the competition comes in. Key to this though, the only way you can be covered by Delacare is to be a legal resident of the state of Delaware. Now, pardon me, you can have many debates about documented, undocumented, illegal, legal, that sort of thing. But Delacare is designed to provide health care coverage for legal residents and legal residents only. That's important to understand. We can talk about immigration another time, but that's the premise we base this conversation on right now. Now, within this basic plan, because it's important for people to have some choice, you can go up or down within that basic plan on savings, deductibles, certain levels of payments for certain things. The basic plan is the core of your health care, but there's choice allowed in there because let's face it, a single mother from Newcastle might have different needs than a retiree from Ellendale. So it gives some flexibility there. That's very important. This contractor will be open to a bid process for 5 years. Now the contractor who's going to administrate this plan makes no medical decisions whatsoever, none. This is between you and your doctor, and that's it. They perform clerical responsibilities only, not making medical decisions. We're not going to let that happen. The other key thing is Delacare will not be tied to your employer. It's important to recognize the economy of the future is going to have a lot of self-employed, a lot of people are entrepreneurs, and as larger companies, quite honestly, shed workers. It's important to know that you have some security as you go from job to job. That's critical. Because financial risk is one thing, healthcare risk is quite another. We have to address that. The other thing is Delacare is a multi-payer system, which is essentially what we have now, but it's just not done very smartly. This will be done with some tax revenue. It will be done from employers, from employees, some from the federal government. It'll be a mix. So everybody has a stake in the game, everybody has responsibilities, everybody provides on a fair basis. That's critical also. We go one step further in Delacare. Besides simply providing health care, we talk about tort reform. Delaware has a shining example called the Chancery Court of Delaware, which handles business dealings. We're revered around the country for our business dealings in the Chancery Court. We would like to do something very smart and have a healthcare court, which takes away some of the lottery luck, some of the insider things that happen in malpractice suits. So not only are patients protected, doctors get a fair shake, and the money that is made off these cases goes to patients and not just to attorneys. Let's face it, I know attorneys have a job to do, but I think most of it just comes down to pure money and not really taking care of the patient, and that's what this is all about. So again, Delacare is a very simple concept. It takes the best of what healthcare is being done around the country and around the world, quite honestly, and puts it in a much more concise pattern. So let's talk about, does Delacare answer the questions we brought up now maybe 3 or 4 days ago about the components of a good healthcare plan? And we think it does, and let me refresh your memory on those. Very quickly, is Delacare patient-centered? Absolutely. Everything done or decided is done for the patient. Is it hassle-free? You bet. You've got one contractor, one provider that's been decided on by a bid, so the headaches with the insurance company are gone. And it suits your individual lifestyle because you get to make choices, and that's very, very important. Now, next thing, does Delacare address 3 very important issues? Choice, competition, and responsibility. Absolutely. As I just said, Delacare allows you to float, to go up or down in certain areas on that core basic plan. That's important. Does it allow competition? Absolutely. We're asking every insurance company to put your best plan on what you can do for us, and we now ask them to compete. Competition works. Personal responsibility. Absolutely. If you do things that are healthy for your lifestyle, you're going to get a break on your premiums. If you do things injurious to your health, unfortunately, you're going to have to pay more. That's just the way it is. Every insurance is based on risk and solvency. We have to introduce risk assessment in healthcare. We can do that. Now, one more thing. Key to this for healthcare is wellness, productivity, and security. If you introduce a universal concept from ground zero, literally from cradle to grave, that's individual, private insurance, not state-run, you introduce wellness from day one for an infant to somebody in geriatric care. That's very, very important. Productivity. If you have a workforce, whether they're working for a small company, large company, mid-size, or their own company, if they're getting adequate health care for a good dollar spent, they're going to be productive. That's very simple. Security. Again, you can move from one job to another. The estimate right now is about 30% of Americans are in their current job only for the benefits. That's a lot of production being lost, a lot of motivation being lost just for benefits. We can do a whole lot better. Now, in the end, is Delacare the key thing we need to take a look at? A balanced, common sense approach to healthcare? Absolutely. It's not a one-size-fits-all solution from government. It's not something thrown on you where you have nothing to decide. It involves choice, it involves competition, it involves you being the key decider of what happened with you and your doctor, not a Washington bureaucrat, not a greedy insurance executive, but you. Again, the plan makes a lot of sense. It's not, once again, it's not the government solution. It's an individual solution provided with a structure that you get to decide on. Take a look at Delacare. It's a great way to go. There's going to be a lot of discussion in the next few months on what to do about addressing healthcare. This is one proposal. Every state could do this. We could truly have universal care that makes sense, doesn't spend more money than it has to, but provides that proper and adequate care for everybody. Anyway, thanks for tuning in. We'll talk more about healthcare as events unfold, and we'll see you again. Thanks.